We're going to talk today about results of a blood test that I had, and this is Dr. Dall joining us now. And so you do these amazing blood screenings that range anywhere from, it goes beyond the basics of what we'll get in a normal doctor's office. So where you would do blood work and find your cholesterol levels and all that, it has that, but then it goes way beyond. So can we talk just about what the blood screen is and some of the things that you look for specifically?
Sure. So ultimately what we want to do is understand who is at risk for having heart disease or even diabetes later in life. And we also want to understand what drives some of the symptoms that we have, what makes us tired, what makes us crave carbs, what makes us gain weight. And there's answers to that. And some of those answers are metabolic abnormalities that we have. Some of the reasons why we have risk for heart disease are related to some of these root cause of disease that we can diagnose with more advanced blood work. And to be honest with you, cholesterol and blood sugar measurements are really not particularly helpful. They tend to diagnose disease too late in the game.
Yeah, and you said something about cholesterol specifically, and you brought this to show us kind of what the difference is in what we would normally be screened for and what a screening like these, and we're going to talk about my results in a second.
Sure, absolutely. So basically what we have in here, this is illustrating cholesterol. Now cholesterol are the little yellow balls, and the other balls are reflecting triglycerides, which are other fatty substances that we need for energy. So our body makes cholesterol, and our body makes triglycerides because we need it for energy, for cell membranes, for hormones. Right. But these are basically fats, and they don't just float around in our bloodstream as fat, because just like water and oil don't mix, cholesterol doesn't mix with blood. So what happens is the liver will package the cholesterol into these particles called lipoprotein particles. And what we find from many, many clinical studies now is it's actually the number of particles you have, the number of these, that drive your risk for heart disease and for diabetes.
Not what's inside.
It's not what's inside. And in fact, you could have, you could have this whole entire ball full of yellow balls, just completely engorged. Or you could have just a few, 2 or 3 little yellow cholesterol balls in there, and this would be it's the number of the actual particles that you have floating around that cause disease. Every particle that has the potential to cause disease, that has the potential to lead to heart attack or stroke, gets a label, and that label is called an ApoB, and that's illustrated with this little blue guy. So the liver knows if this particle has the potential to cause disease later, we're going to label it, basically label it a bad guy. So we want to measure how many of these particles you have and how many of these ApoBs are there to understand what your true risk is. Okay. It's much more accurate.
So it really gets it, and it is confusing, when we get into the details of it. But the bottom line is there's much more to your blood work and much more to your results that determine all sorts of things, like you said, diabetes, heart disease. Right. Specifically with women, though, I want to talk about this because in my results, one of the things that mine showed was almost an extreme vitamin D deficiency.
Right.
And you said that's relatively common for women.
Very common. And I think we're all trying to protect ourselves, protect our skin from aging and from cancer, and so we wear sunscreen, and we basically block our ability to make vitamin D. And so part of our panel is to really understand if there's any abnormalities with vitamins, one of them being vitamin D, which is critical.
It is critical, and here's what she was telling me during the break is if you are tired, sluggish, maybe you've gone to the doctor with those symptoms and they've put you on like an antidepressant or something, I would go get this test and test your vitamin D levels, because you said a lack of vitamin D in your body gives you those symptoms.
Absolutely. Fatigue, muscle aches, depression, sluggishness. It increases your risk for diabetes, cancer, heart disease, so many other things. And it's very simple to address vitamin D. You don't need a prescription for that. Right. In fact, the prescription vitamin D is really not much different than what you can get over the counter. Vitamin D3 over the counter is very effective. The little gel caps, not the tablets, but the gel caps work well.
And it does, from an anti-aging perspective, it does help protect you because it's an anti-inflammatory, isn't it?
Right, absolutely. Lots of benefits to vitamin D.
So interesting. Oh my gosh, who knew? This is my reason for being so tired all the time, honestly.
I guarantee you're going to feel better because your level was really, really low.
I know, but everything else was fantastic. Tell them how good everything else was.
Everything else, I have to say, I looked at her panel, I said, I've treated, over the last 15 years I've been doing this advanced testing, and I've seen very few people with as many greens as you have there, so I have to say, she is a picture of perfect health, yes.
It's so helpful to understand it, though, and then you just know what to continue doing. Continue to eat healthier, to continue to drink your water and get some exercise and all those things. I love what you guys do over there.